Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name, please? Nice to meet you, Mr. Noman. May I know what brings you here today? Okay. Tell me more. I'm very sorry to hear about that, Mr. Noman, and I understand your worries. But before I come to the management part, let me ask you a few questions so that I can better understand your condition. Is it okay with you, Mr. Noman? Thanks for your cooperation, Mr. Noman. So since how long you are suffering from shortness of breath? Okay, and how often you have a shortness of breath? All the time. Have you noticed shortness of breath on lying down? Okay, do you have any long-standing cough along with that? Okay, if it is dry or productive? Okay, so have you noticed that you produce a cup full of sputum? Okay, have you noticed any change in your voice? Alright, may I know your age, Mr. Naman? I'll ask few personal questions to better understand. Is it okay with you? Thanks for your cooperation, Mr. Noman. So, are you a smoker? How many cigarettes you use per day? And since how long? Alright, have you ever tried to quit this habit? I really appreciate Mr. Noman and we'll talk in detail in next appointment how it sounds to you. Okay, Mr. Noman, so along with that, is there any musical sound while breathing? Have you experienced these symptoms in past as well? Okay, may I know in which season? Winter. Okay, if there is any fever, have you noticed any night sweats? Any significant weight loss on weight gain? Alright, Mr. Noman, if there is any history of travel for more than 5 hours? Alright, Mr. Noman, so I'll ask you a question, okay, regarding skull. So let me know, okay. So if you're troubled by breathlessness, except on strenuous exercise, okay, you become short of breath when hurrying working up a slight hill, okay, walk slower than contemporaries because of breathlessness, okay. Have you noticed that you stop for breath after walking about 100 meters? Okay. You become breathless to leave the house, even on dressing and undressing. Alright, Mr. Noman, and do you have any disease like asthma? If you had any tuberculosis? And do you have high blood pressure, high blood sugar? Alright, Mr. Noman, is there any variation in your breathlessness during the night? Okay, and are you normal in between attacks of breathlessness? Okay. And what happens to your breathlessness when you lie down? Okay. Alright, Mr. Noman, have you ever cough up blood and have fever? Okay. And do you have any chest pain along with that? Okay. If you had any trauma? If you are married, Mr. Noman? Okay. And do you have kids? Okay. How's everything at home? What do you do for a living? Okay. How's everything at workplace? Alright. How about your sleep pattern, Mr. Noman? Okay. If you're taking any medication prescribed by doctor or over the counter? Okay, taking any medicine for your breathlessness and cough? And do you have any allergies? All right, Mr. Noman, if there is any immediate family member suffering from similar condition in young age? Mm-hmm. All right, Mr. Noman. So, how this condition has affected your life? I'm really sorry to hear about that, Mr. Noman, and I understand your worries. Okay, and let me reassure you that I'll try best of my abilities. Okay, to sort it out and solve your problem. Okay. Mm-hmm. All right, Mr. Noman. So, to better understand, I need to examine you. Is it okay with you? Thanks for your cooperation, Mr. Noman. Can you please come to the couch? Then I'll glance at face of a patient. If it is pale, not, and then I'll check for anemia. Mr. Noman, can you please look up, look down, and show me your tongue, and then I'll check his hands and palms if they are moist, and if there is any palmar erythema, and then I'll check for if there is any nicotine stain on his fingers, and then I'll check his nails if there is any clubbing, coloncia, or spoon shaped, if there are any notes, and then I'll check pulse. Mr. Noman, can you please stretch your hands and open your fingers? Then I'll check flapping tremors. All right, Mr. Noman, can you expose your back so that I can examine? Thanks for Mr. Noman. So I'll start from inspection. I'll check if he has increased breath rest, or if he is using pursed lip breathing, and if he is using any accessory muscle, and if there is any asymmetry or decreased movement, or any bulging, any deformity, any scar mark, and then I'll palpate and for chest expansion, and then I'll percuss if it is hyperresonant chest or not, and then I'll auscultate a chest, all the zones, apical and base, and then auscultate heart at four areas: aortic, pulmonary, tricuspid, and mitral. And then I'll check shins for pedal edema. Thanks for your cooperation, Mr. Noman. You can have your seat. Okay, and again I'll sanitize my hands. The initiation and at the end of examination. Right, Mr. Noman. So to better understand, I'll do a few investigation. Okay, how it sounds to you, Mr. Noman? Yes, Mr. Noman, it is a peak expiry flow rate and to monitor at home, okay, and spirometry, chest X-ray, full blood count, okay. But before I order, let me confirm it from you that if you have undergone an investigation so far. All right, Mr. Noman. So sign and symptoms we discussed, and examination I have performed, okay. And the chest X-ray you have shown to me. I've come to the conclusion that you are suffering from condition what we call in a medical terminology is COPD. Okay. Yes, Mr. Noman, it is a common condition that mainly affects middle-aged or older adults who smoke. Okay. Yes, Mr. Noman. So I'll offer an non-pharmacological and pharmacological management. Okay. And so first I'll talk about non-pharmacologicals. Okay. So I'll strongly recommend you to to stop smoking. Okay. It is single most important thing to improve outcome of treatment. Okay. Yes, Mr. Noman, stop smoking is a treatment of COPD. Okay, do you agree with that? Yes, Mr. Noman. And besides that, I'm offering you vaccination against influenza. You have to take influenza vaccination annually. Okay, and pneumococcal vaccine once in life. Okay. Yes, Mr. Noman, besides that, I'll encourage you to do a gradual increase exercise, okay, because it will um, improve your pulmonary rehabilitation, okay, and through pulmonary rehabilitation, and it will improve your breathlessness, okay. Mm-hmm. And besides that, I'll encourage you to lose weight, okay. It will help you to improve exercise tolerance, okay. And so now let's come to the pharmacological treatment. So Mr. Noman, I'm prescribing you salbutamol inhaler, okay, 200 mcg, okay. You have to take one puff 3 times a day and as needed, okay. But let me demonstrate inhaler technique, okay. So first you have to remove the cap, okay, and hold it between your thumb and index finger, okay, and shake the inhaler for 3 seconds, okay, and then breathe out completely, okay, and then place inhaler in your mouth, securing your lips around the mouthpiece, okay, and begin to breathe in deeply and activate the inhaler at the same time, okay. Mm-hmm. And yes, and complete the inhalation and hold your breath for 10 seconds, okay, and then you can breathe out, okay, and breathe in normally, okay. Is everything clear till now? Should I demonstrate again it for you? All right, Mr. Noman. Besides that, I can refer you to a physiotherapy for pulmonary rehabilitation, okay. And if you notice and you become short of breath